My number came back at 357. It is a terrifying wake-up call that forces you to look directly at your mortality. For 13 years, I drew blood in a hospital setting where the patient feels like they are constantly failing a test they were never taught how to pass. The system set them up to fail, but you do not have to accept it. The healthcare system can feel like a maze of closed doors and hidden secrets, but you don't have to navigate it alone. This is the clinical watchdog, unraveling the mysteries of modern medicine so you can take back your power. Heart-healthy habits are boring, right? That is exactly what the modern medical system, the multi-billion-dollar fitness industry, and mainstream media expect you to believe. They want you to think that taking control of your cardiovascular health is this miserable, exhausting, joyless chore. They paint a picture of you eating nothing but raw, unseasoned vegetables, running on a treadmill until your knees give out, and measuring every single drop of enjoyment out of your daily life. They make it look like an extreme sport, designed only for professional athletes or the wealthy. But what if I told you the industry has it completely backward? What if the very things your primary care doctor is telling you to focus on are actually setting you up for failure? Today, we are tearing into a recent groundbreaking revelation from medical economics that exposes a massive systemic flaw in how doctors are treating our hearts and our overall health. The article is titled, "Small Changes Are Big, Big Changes," and it highlights a harsh truth. Doctors have been focusing on the wrong numbers, the wrong goals, and it is actively costing us our lives. This isn't just some abstract medical theory. I'm the clinical watchdog, and we need to have a serious talk about why your doctor's boring advice is actually a dangerous trap, designed by a system that profits heavily off of your confusion and repeated visits. Let's pull back the curtain. For 13 years, I drew blood in a hospital setting, in an outpatient setting, and in a fast-paced doctor's office setting. I interacted with thousands of patients from all walks of life. Different labs were ordered every single day, and I'd watch as the doctor hyper-focused on that one specific outcome number. They look at a piece of paper of the results of the blood work, circle a number in red ink, and treat that single metric as if it is the entire comprehensive picture of a complex human being's health. I saw the conveyor belt of medicine firsthand, the same patients coming back month after month, their numbers getting slightly worse, their prescriptions getting slightly stronger, and their hope completely fading. It becomes a revolving door of frustration where the patient feels like they are constantly failing a test they were never taught how to pass. I recently found myself sitting on the other side of that exact equation, staring down the barrel of the medical machine. I went in and took a CT calcium score test, a specialized, non-invasive scan that looks for calcified plaque buildup in the coronary arteries of the heart. It is the plaque that causes heart attacks. My number came back at 357. To put that into perspective, a score of 0 is ideal. A score of 357 places me at a moderate to severe risk for chronic congestive heart disease. Hearing that number is like having the wind knocked out of you. It is the kind of news that stops you dead in your tracks and makes you question everything. It is a terrifying wake-up call that forces you to look directly at your mortality. Now, the standard medical response from the industry is to look at that 357, panic the patient, and immediately throw heavy, lifelong prescriptions at the problem. They want to medicate the number away. But this article from Medical Economics finally admits what I've seen from the inside for over a decade. Focusing purely on these outcome metrics sets patients up for absolute guaranteed failure. When we stare at a lab result, we are looking at the past. A lab result is nothing more than a historical document of what you did over the last 6 months. It doesn't tell you how to survive tomorrow. It doesn't fix the daily behaviors, the stress, or the habits that actually caused that plaque to build up in the first place. Yet, the entire healthcare system is built around worshiping that outcome number, completely and totally ignoring the human behaviors required to actually change it. When a doctor scolds you for a high lab result, they are essentially yelling at a scoreboard after the game is already over. It creates guilt, shame, and anxiety, none of which heal the heart. Instead of teaching you how to play the game differently tomorrow, they just give you a pill to artificially alter the scoreboard. This is the fundamental brokenness of modern medicine. It is a system of delayed gratification, waiting for you to get sick enough to require their most expensive interventions. And this is exactly what we need to stop from happening. And this systemic failure doesn't just happen when you are dealing with a high calcium score. It bleeds into every single facet of modern medicine. Whether you are facing a moderate to severe risk of congestive heart disease, looking at terrifying tumor markers for a possibility of cancer, struggling with a complex thyroidism misdiagnosis, or trying to get real, concrete answers for Lyme disease, the system's reaction is almost always exactly the same. Let's paint the picture, because millions of Americans live this exact nightmare every single day. First, you get the alert on your phone from the patient portal. You see a number flagged in red before a doctor even calls you. You spend the whole weekend terrified, Googling worst-case scenarios, your anxiety going through the roof. Finally, you get into the office. You are sitting on that crinkly paper on the exam table. You are vulnerable, you are scared, and you are desperately waiting for a lifeline. The doctor walks in. They are rushed. They look at a screen instead of looking you in the eye. They drop a massive, life-altering diagnosis on your lap in a span of 3 minutes. Then, they hand you a printed piece of paper, write a script for a pharmaceutical, and say, "Take this medicine, and we'll see you in a couple of months." Let me be incredibly clear, that is not healthcare. That is a transaction. When they do that with thyroidism, they look at your TSH levels, say they are normal, and completely ignore the fact that you are chronically exhausted and gaining weight. When they do that with Lyme disease, they hand you a standard antibiotic and dismiss the lingering, crippling fatigue as just stress. And when they do it with heart disease, they hand you a statin or a blood pressure pill and expect the problem to magically resolve itself. Setting unrealistic goals, like telling a patient they need to completely overhaul their entire life overnight without any structural support, is a guaranteed recipe for disaster. The healthcare industry operates on the false premise of delayed gratification and fear. They expect you to be so terrified of a bad lab result or a severe diagnosis that you will somehow figure out a massive lifestyle change entirely on your own. When a doctor tells a patient with a 357 calcium score or a newly diagnosed chronic illness to simply eat better and exercise more, you have to understand that this is not a medical plan. That is a dismissal. It is a complete failure to recognize the human being sitting in front of them. It is far too vague, too massive, and too burdensome for any normal person to process while they are simultaneously dealing with the shock of a diagnosis. So, what happens? The patient goes home. They throw out half the food in their pantry. They make completely unrealistic promises to themselves. For 3 days, they try to live like an Olympic athlete, but then real life hits. They get tired. The stress of the diagnosis builds up. The sheer scale of the changes becomes overwhelming, and they give up after a week. They feel like a failure, when in reality, the system set them up to fail. When they end up right back in the clinic a few months later, the doctor looks at the lab numbers, shakes their head, and increases the dosage of the medication. Think about the financial cost of this cycle. You are paying co-pays, deductibles, and pharmacy costs month after month, year after year, just to maintain a baseline of sickness. The industry makes billions off of your daily prescriptions, but they do not make a dime off of teaching you how to grocery shop efficiently or how to manage your daily anxiety. We are treated as passive recipients of pills, expected to fix our complex behavioral habits in a vacuum. It is a vicious, endless, and highly profitable cycle for the medical industry, but you do not have to accept it. This is exactly where we flip the script, stop playing their game, and take our power back. Changing your health trajectory requires a mutual, two-way discussion between you and your doctor. It cannot be a monologue where the doctor speaks from a position of authority and you just nod silently. And as a patient, you have to step up. You cannot afford to be vague either. You cannot sit in that exam room, overwhelmed by a diagnosis, and just say, "I want to do better, just tell me what to do, I'll do whatever it takes." That is a wish, not a strategy. Doctors hear, "I'll do whatever it takes" 20 times a day, and they know it rarely lasts. You have to force the conversation into the realm of reality. You have to demand concrete, realistic goals, and you have to hold them in the room until you get them. Doctors are trained to use the doorknob technique to signal the appointment is over. Do not let them turn that handle until you have a real plan. Let's break down exactly what that mutual discussion needs to look like. If the goal is changing your diet to lower that calcium score or balance your thyroid, the discussion shouldn't end with a dismissive, "Eat less salt" or "Watch your carbs." The discussion needs to be, "Doctor, let's arrange a referral right now for a registered dietitian, and I need a dietitian who can work with my actual grocery budget and my actual family life." You need someone who understands that you are cooking for a household, not just yourself. You need someone who doesn't expect you to buy expensive, exotic, organic foods you cannot afford. You need real-world nutrition that fits your wallet. If the goal is exercise, you cannot just blindly agree to join a gym you will never step foot in. The discussion must be, "Let's build a realistic routine that actually fits into my schedule." If you work late shifts or have long hours, you cannot be expected to wake up at 5 in the morning for a marathon run. Let's find 10 or 15 minutes a day that you can actually commit to without feeling exhausted. Real health is built on consistency, not intensity. It can be a daily morning walk around the block. It can be a 10-minute chair Tai Chi routine right in your living room to get your blood flowing and improve your balance while you watch television. It doesn't have to look like a sweaty fitness commercial to save your life. It just has to fit your actual life, or it simply will not work. If your doctor tells you to lose 30 pounds by your next visit, you have to push back and ask, how exactly do we start that today, step by step? Breaking a massive medical goal down into tiny, microscopic daily inputs is the only way to succeed. When we try to change everything all at once, we change absolutely nothing. And then there is perhaps the most completely ignored, most destructive factor in all of modern medicine: stress. Stress is a massive, aggressive catalyst in congestive heart disease, autoimmune flare-ups, and metabolic crashes. When you are chronically stressed, your body is constantly flooded with cortisol. That cortisol raises your blood sugar, spikes your blood pressure, thickens your artery walls, and literally destroys the body from the inside out. Yet because the medical system does not have a specific, profitable billing code for stress reduction, they completely ignore it, or they just try to write you an anti-anxiety script. We live in a culture that glorifies being overworked and entirely burnt out, but your heart does not care about your deadlines, and your immune system does not care about your overtime. If we do not actively carve out space for mental recovery, the body will eventually force us to take a break by shutting down entirely. Your doctor needs to be asking what is stressing you out, and you need to be actively discussing what practical, immediate things you can implement to lower that stress load. What responsibilities can you take off your plate? What personal boundaries do you need to firmly set with your family or your job? It is about realizing that saying no to extra commitments is actually a medical necessity. You are not being selfish when you protect your peace. You are protecting your physical heart from the silent damage of chronic tension. We have to stop wearing exhaustion like a badge of honor. This is what they don't want you to know. True health is built in the quiet, mundane, beautifully boring moments of your day. It is built on the decision to drink an extra glass of water, to take 5 deep breaths before a stressful meeting, and to advocate for yourself in a sterile exam room. These actions are not glamorous, and they will never make the medical industry rich, but they are the absolute bedrock of human longevity. It is never just about taking a pill and waiting 60 days in silence. It is about a holistic, scheduled, and highly realistic approach to your daily inputs. You control the input. The output takes care of itself. Do not let a scary lab result or a severe diagnosis convince you that you are just a passenger in your own body. The system wants to treat you like a metric and pacify you with a prescription. Do not accept it. Do not let them rush you out the door without an actionable plan. Demand the dietitian. Demand a realistic schedule. Address your stress aggressively. You are the CEO of your own health. Small, consistent, realistic changes aren't boring. They are the ultimate rebellion against a system that profits off your sickness. Stay loud, stay informed, and refuse to be a passive patient. I'm the clinical watchdog, and we're just getting started.